Hi guys, welcome back to my channel. Today I am at my parents' house doing laundry. Our dryer is broken, so I've got some time to kill over here. So I thought I would do a video talking about OR nursing. I am currently a circulating nurse at a surgery center. I was at a hospital before, so I can also do a video like talking about pros and cons of working at each of those if you guys would be interested in that. But yeah, I just kind of wanted to walk you guys through like a typical day as a circulating nurse in case anyone is interested in going into surgery. And surgery is a specialty area, so the orientation for a circulating nurse is usually about 6 months to a year, depending on where you're getting trained at. I was at the hospital in our local community, and it was supposed to be 6 months, but they ended up being really short-staffed. We had mostly travel nurses, so they ended up pulling me off orientation, I think at like 3 months it was, 3 or 4 months. So yeah, it can really depend. If you get into like a bigger hospital, they probably have like a whole little program set up where you will do like didactic training, and then you'll have days in the OR as well. So yeah, it really just depends. But I think typically it's around 6 months. Yeah, so I'm just gonna walk you guys through like a typical day for me. So when you come into the hospital or surgery center, you are going to go into the locker room and you're gonna get changed into surgical scrubs. So you can pretty much wear like your pajamas to work, which is really nice. You can wear whatever you want, because you're just gonna get changed anyways. And then you'll go out to like the front desk area, and they will usually have like an electronic board and a whiteboard that'll have like all the cases and what room you're gonna be in. So I'll look at that. We might do like a morning huddle where the managers will say whatever they have to say for the day, and then I'll head to my room, grab a schedule, head to my room. I will turn on the computer, open up my patient's chart, and I will look at like medical history, surgical history, labs, allergies, what medications my patient is on, and then I'll look at orders, what antibiotic the patient is going to need for that procedure, and then like what medications they're going to need for the procedure as well. I will go grab those medications. I'll grab any equipment, machines that I'm gonna need that's not already in the room. I'll bring all those in. I'll set those up, turn them all on, make sure they're in the right spots, make sure they're working properly. I'll set up whatever OR bed we are gonna be needing. And by that, I mean like for like spine, for instance, you'll need like a specialty bed for that. Or anterior hips, you're going to be using a specialty bed, but for the most part you'll just have a standard OR bed. So I'll set that up, and then I will help the scrub tech open any like sterile instruments, anything that they need opened onto their sterile field. I'll help them get stuff ready, and then we will do a count together. As the circulator and the surgical tech, we will do a count of all of our soft items, so like blades, sutures, Raytex, lap sponges, stuff like that. And then if you are doing like an open belly case, you will count your instruments, or if it's a laparoscopic case that could turn into a open belly case, then you'll count the instruments as well. And then I'll hand off like my medications onto the sterile field as well. And then once I know that the surgical tech is all good to go, the room's all good, I will go into pre-op and I will look at the patient's hard chart. I will make sure that consents are signed by the patient or a legal guardian, and that it is the correct procedure listed and that the surgeon has also signed. I'll look at the antibiotic. I will get the antibiotic ready, maybe hooked up. And then I will ask my questions to the patient. So I will go over and look at their wristband. I'll ask them their full name, date of birth, allergies, what procedure they're getting done. Say they're getting a knee done, I will make sure that they tell me if it is the right or left knee. And then I will usually ask them if they have anything removable on the body. I'll ask them if they have any metal anywhere inside the body from previous surgeries. And that is for the purpose of if we use cautery, because you need to put a grounding pad onto the patient if we are going to use cautery. And that cannot go over metal, or it shouldn't be near metal. So say they have a right knee replacement, I'm going to put the grounding pad on the left thigh instead. And then I will ask them like if they're on any blood thinners, last time they ate or drank anything. So yeah, I usually go through this routine of questions. It may differ depending on the procedure, but for the most part, you're gonna ask like the same questions. And always like the basic name, date of birth, allergies, procedure. Like those are for sure something you are gonna ask every single time. And then I will get my CRNA after I've asked all my questions. I feel like we're good to go. I will check with the pre-op nurse, make sure she's all good if we take the patient. And then the CRNA will ask their questions, and then we will roll back to the room if everything's good and we're all ready to go. Once we get into the room, we will either put the patient to sleep on the stretcher or onto the OR bed, depending on the surgery, but for the most part, we will have them scooch over to the OR bed and then put them to sleep there. And during induction, you are going to be up at the head of the patient, helping anesthesia, put them off to sleep. You're not going to be pushing any meds as a circulator, but you may hold the tube for them. Pretty much whatever anesthesia needs, you have their full attention at that time and have the full attention for the patient, because they are drifting off to sleep. It can be scary, you know, some people might be nervous. You have to be there to hold their hand and calm them. So yeah, that's your main priority. And I mean, your main priority the whole entire time is obviously being a patient advocate. Your patient is going to be asleep. They cannot speak for themselves. So you have to be that person to look out for them. So after they are off to sleep, I will, as a circulator, I will prep the patient and position the patient. Well, first we'll position and then you prep. And you will get sorry, I almost dropped my phone there. You will get a pick sheet with all of the surgeon's preferences. So it will tell you how they like the patient positioned and prepped and everything. So you'll do all that and then call the surgeon into the room. He or she will double check everything's good, and then they will go out of the room, they'll scrub, and then they will come back and get all gowned up, all that. And the surgeon and the surgical tech will start draping the patient, and then once the patient is draped, they will start handing off cords that need to be plugged into the machines. And as a circulator, you are plugging all those in, you're spiking the bags for irrigation, all of that. And then right before we are about to cut, I will do a timeout. So this is where everyone in the room is going to be quiet, and you are going to say all the patient information like name, date of birth, age, allergies, what procedure we're doing, what antibiotic they got. If they got a pregnancy test, you're going to say UCG negative, maybe critical lab values. So you're saying all of that, and then after you're done, everyone should say I agree, and then they can begin. And then once they cut, you are going to be doing all of the charting. So you're going to chart everything from the second the patient got in the room to the second they leave the room. And then also, while you're charting, you are going to be the person that is getting anything that anyone needs. So if anesthesia needs something, they cannot leave the patient. They are monitoring the patient. So you either are going to have to get whatever it is if it's in the room, or you're going to have to call out for someone to grab it, or you need to leave the room yourself and hurry back. Same with, obviously, if the surgeon needs anything, scrub tech needs anything, you are that person. Everyone else is scrubbed in besides anesthesia. But like I said, anesthesia cannot leave the patient. So that is your responsibility. So you are doing that, running around the whole time and charting. And I mean, most surgeries, if it's pretty basic, the surgical techs should have everything they need for the most part. You might need to open some stuff, or, you know, if you're doing like a total knee, let's say, you're obviously going to have to open all the implants and stuff with the rep. So that's what you're doing the whole time. And then once the procedure is over, you're going to call out to post-op and say, hey, we're all finished. Do you have a spot for us? And they'll say, yep, come out to spot 2. And then once anesthesia is all ready, you know, patient's waking up, we will roll them back to post-op, and we'll start hooking them up to the monitors in PACU, and I will give the PACU nurse a little report. Hey, this is so-and-so, this is their allergies, this is what procedure we did. We used 20 of local. They also got these medications, and this is the dressing we put on. They have a Foley in, all of that. So yeah, this is just kind of a general overview of what we do on a daily basis, but I mean, it's hard to say because every surgery is different. But like I said, this is just a general overview. If you guys have any questions about anything, you can leave them down below. I would be happy to answer them. And, you know, I might be able to get some footage at work someday. Maybe I'll try to bring my phone or camera into work, into the OR. Obviously not when a patient is in there, but I could film, you know, maybe setting up some stuff, if you guys would be interested in seeing that. And if not, that's okay too. But I would love if you guys could leave me maybe some recommendations of what kind of videos you guys want to see, and I would be happy to do them. And yeah, thank you for watching. Please like and subscribe. I appreciate it, and have a great day.